Today's reports are higher than the last several weeks. In fact, this is the highest Monday that we've had with 2,319 cases. Again, we'll be watching, especially moving into next week, on how many of these Monday cases may have been backed up in the system from really 2 holiday weekends in a row. Currently hospitalized in Kentucky, 1,737. That's up. Currently in the ICU, 456. That's up. Currently on a ventilator, 216. That's up over yesterday. Again, when we saw the trend line still down compared to other times. Current positivity rate, 11.2%. We talked about this. We're going to be watching it. We can't tell you definitively right now whether this has been, again, inflated by what testing is open or not, or as a result of private gatherings over the holidays. We think it is some of both, but it's going to take days for the data to show us the truth. New deaths today. Hard day with 26 deaths. They include 2 individuals from Boone County, a 79-year-old woman and an 81-year-old man, a 54-year-old woman from Boyle County, 4 individuals from Campbell County, 3 women, ages 73, 84, and 92, and a 72-year-old man, a 92-year-old man in Franklin County, a 70-year-old woman in Gallatin County, 2 men in Grant County, one just 40 years old, and one 70 years old. In Jefferson, we lost 4 individuals, a 95-year-old woman, and 3 men, ages 72, 78, and 92. In Kenton County, we lost 7 individuals, 66-year-old woman, 74-year-old woman, 99-year-old woman, 102-year-old woman, 86-year-old man, and an 88-year-old man, and a 90-year-old man. In Lewis County, we lost an 82-year-old woman. In Marshall County, we lost a 65-year-old man. In Simpson County, we lost an 89-year-old woman and a 64-year-old man. New cases by county: Jefferson, 429, Fayette, 170, Boyd, 102 cases, Kenton, 80, Warren, 76, Pulaski, 71, Boone, 66, Bullitt, 59, Henderson, 59, Pike, 57, Oldham, 52, Logan, 51. You can find the rest on kycovid19.ky.gov. Long-term care. Again, this is the reason that long-term care residents and staff are in the very first group, because the magnitude of the loss there. 105 new residents testing positive, 126 new staff, 37 deaths, additional deaths attributable to long-term care. Folks, the only way that we can stop this now is to stop the community spread. It's what we are doing in our communities or what we're not doing. It's not following the rules and regulations enough, not wearing a mask, not engaging in social distancing, not being careful, that ultimately costs the lives of individuals in these facilities. Please, these are real people. And this is just in long-term care, 1,858 people that have passed away because we couldn't keep COVID out of the facility because of community spread. We need to do better. And speaking of needing to do better, I think that's a fair way to characterize the vaccine rollout across the country. Number of things that I believe the federal government underestimated. First, the amount of time for each individual vaccination that's done. It takes signing somebody up and getting the consent form. It takes asking several questions to ensure that you're not giving the vaccine to someone who might have a severe reaction or has had a fever, all those questions. Then it takes the vaccination itself and some form of monitoring for a certain period thereafter. So this isn't something, when you think about that, 8 to 10 minutes per individual at least, that one person working a normal work day can hit the type of numbers that we need to hit to get people vaccinated out there. I think a couple of other things that were underestimated by the federal government. And that's when you have a really narrow first group, which we did, and I understand why. And especially on the hospital side, if each vial has been allocated to individuals, when the group is smaller, there appears to be less urgency to get it out to those individuals because you know that they're going to get one because of the way it's been set up. But we need to move faster. We need those that have already received the vaccine to move faster. We need our partners in long-term care to move faster. So today we're going to talk about some changes that we're making, providing some additional clarifications. So if we ever have one of those two stores, one in Lexington and one in Louisville, that thaw too much again, they know exactly what populations should get it. And then you're going to see in the coming days, we're going to be pushing harder and harder and harder to get these vaccines in people's arms so much faster. And we're going to have to really be building up larger operations that we can get more people through. So let me be clear. I am not satisfied by the pace of vaccination here in Kentucky. While I think it is the same across the country, that's not what I was elected to do. I was elected to do my best for you, the people of Kentucky, and we are going to do better. So let's look at what has been allocated. This doesn't mean it's been received in Kentucky. We've gone over this before. So this was the amount that was allocated in December. Now, some of that last part of December is still coming in. So there is a difference between what's been allocated and what's been received as it is logged into the system. Let me also say we have delays in reporting in each and every part of this system. So I know when we talk about the number vaccinated today, it's higher. Now, groups that are vaccinating are supposed to report within 24 hours every vaccination. That target is not being hit. And so we're going to be communicating to each and every one of those providers that that is a must and that is a requirement to get additional doses of vaccine. We have got to have better data, and that's from both our long-term care program and what's currently the healthcare worker program. And we're not going to stop until we have it, and until we have it daily. What we will do right now is every Monday, we're going to provide a vaccine update. And we are not going to be updating the vaccine numbers every day online until we believe that they are accurate, until we've got that reporting coming in. We believe if we do it weekly right now, it can be accurate. And the moment we believe that we are getting those reports in within 24 hours, we will move back to daily. But we want to make sure that what we're telling you is as accurate as we can get it. So we have had 2 January allocations as well. One from Pfizer. The vast majority of this is going to long-term care. And when I talk about some numbers in a minute, you'll see that of the doses received by our long-term care partners, only about 20% have thus far gotten into individuals' arms. But under the contract with the federal government, to have this program going, to even have the vaccinations that are occurring right now, we have to send a certain portion to them. That means it's going to be really important in our partnership with CVS and Walgreens that we do a couple things. One thing that we've already reached out is we are